shared in this forum. I think I should say, while Dr. Jeet and the organizers invited many of the speakers here, I was one unusual person who invited myself. I had a meeting with Dr. Jeet a few weeks back, and he made a casual mention of a program like this, and I said we should be there. And why we should be there? Because we're not just selling equipments, we're not just providing transactional support for providing equipments. As Genworks, we're doing something much more. And in a forum as this, especially Healthcare Summit, where we're looking at shaping the future of healthcare, I thought Genworks, a company which is invested by Wipro GE, has a purpose to be here, because our purpose is clearly to shape the future of healthcare and do a bit, in putting this together to make it more efficient. So thank you, Dr. Jeet, and thanks organizers for giving us the opportunity. So then, what is Genworks? And yesterday, I had a very interesting conversation with Dr. Sridevi in yesterday evening, where we were discussing. So while I was trying to explain what we are trying to do here, he brought up a very interesting quote that he read from our CEO Jack Welch's book. He said, if you are wanting to, Jack Welch says that if you want to do something serious, put your best resources, get your best resources to lead that, and that's when we're serious about doing that. It was very interesting. I was reminded about the conversation I had with my CEO Terry Krishnam a few years back. A couple of years back, I went to her. Before this thought of Genworks came to me, it was her thought, her brainchild. I explained what we are doing here with Genworks. And I went to her saying that, Terry, I'm 25 years now in healthcare, and I wanted to be patent. So I went and told her that, I'm 25 years, I completed 25 years serving healthcare. She said, I'm 25 years this year serving GE in healthcare. And she said, let's do something better. Let's do something to make healthcare better, to improve outcomes. And a few days later, she called me and said, Ganesh, GE's mission is to work for healthcare in India. And can we just do the service mission without being able to improve access to technology? Can we do this just by supplying equipments, where customer already has found a need for it, or just restrict ourselves to selling equipments? And it was a very difficult, it was difficult to think about it that way, because clearly, if our purpose, if our commitment is to work for a healthier India, we just can't stay back and say that we supply equipment when a customer wants. And that was the genesis of Genworks. Genworks was created with that thought process of how to reach technology, and technology not as problems, technology as solutions, and the solutions that is determined by the customer needs, not by what we want to provide just because we have created some. And that's Genworks, and I'll explain in detail in my presentation as to what we are trying to do here as a Wipro GE invested company, taking care of the Tier 2, Tier 3 markets. Genworks represents 435 of the 630 districts of India, and all of them in Tier 2, Tier 3 markets. All of them are underserved and clearly with a huge potential, huge need, huge expectation of the healthcare to be provided, the best quality, best in class healthcare to be provided. So we clearly know this. The biggest problem that we have in the markets that we serve, as Genworks serve Tier 2, Tier 3 markets, is the maximum people live here. But in terms of experts, doctors, specialists, we have only 30% of them who are here taking care of the 70% geography, whereas the other way around, in the metro and Tier 1 geographies, we have 30% of the population served by 70%. So how can we change this? How can we make sure that it's not about just selling equipment, as I keep saying. It's more about understanding the needs of customers in these markets and trying to see how we can use technology efficiently. So what are we doing here in Genworks? Fundamentally, we have a fundamental responsibility of creating reach. Reach is by creating efficient reach. Creating a team of people who are experienced and capable and available closer to you. Historically, companies, including GE, served this markets, tier 2, tier 3 markets from a distance of 500 to 1,000 kilometers. Our engineers had to reach you when you had a problem. So in the last 1.5 years that we had as Genworks, we have crushed that to 250 kilometers. We have people, we have 285 people, direct employees, directly working for Genworks, now working closer to you, and we can serve you as close as 250 kilometers. That's the first step that we have done. So what else can we do? We are trying to improve capability of this team. And I won't say that we are already there, but we are trying our best to get there. And as we make ourselves capable, we also want to make sure that with the experience of knowledge that we have acquired through the interactions with you, can we put together solutions? Can we not just be an improving access company, can we also make sure that we put together solutions from the technologies that we provide to you that makes healthcare affordable. So this is exactly what we are trying to do, and this is the only way I believe that we can reach healthcare to the last mile. So Genworks is all about enabling adoption of relevant and high quality technology to improve healthcare outcomes. So what are we doing here? So I said we are getting people close to the customers. We are focusing ourselves to make sure that we understand the end-to-end of customer segmentation, so that we can not just provide solutions for one part of the needs, but for the complete needs. My colleague Kiran yesterday spoke to you about how we are putting together financial solutions. We clearly believe education, healthcare education is the key to optimize equipment use and to continuously learn. And this is one profession. I think I'm always proud of addressing the doctors, because they are the ones who learn all their life. They learn and continuously learn all their life, and to serve, to make their efficiency better. And how can we aid in that? How can we help in that? How can we put together tele-solutions? We had speakers talking about the efficacy of tele-solutions. And clearly, with broadband, with the limitation of expert resources, and with the kind of terrain that we are dealing with, as much as in Northeast, in any part of the country, we certainly need to leverage this. This is not the only solution, but this is a good enabling solution, and can be offered, and you can use it to the best level that you would want to use that. Human resources is a key challenge, and that's where our healthcare institute that we have created with GE and Healthcare Sector Skills Academy, we are trying to see how your resources can be trained efficiently, accredited, and make sure that they deliver the best outcomes. That's one of the key initiatives that we have done to improve healthcare outcomes. And how we can package technology. We have been a lot of discussions in the speakers before that what is the efficient package? Is it what we want to provide as equipment selling companies, or if we want to align this to the needs of the customers to make it the most optimal? For that, care has to be complete. It can't be that I'm here in a part of it and you figure out ways to find out the rest of it, and we are trying to put all of this together as Genworks solutions. So the digital solution that we are trying to do is, we say that we have specialists, lack of specialists, we have limited specialists, and can we make this expertise that's available in pockets available in a much more liquid form, where it can be reached by all. Can we use digital and mobile interpretation? We already know about teleradiology solutions. We are also venturing into telecardiology solutions, especially in ECG reporting, and to make sure, can we create something? We already partnered with the company who does ECG reporting, not just ECG remote reporting, but also to create a hub and spoke. You have a cath lab, you have an ability to intervene, you have an ability to solve a cardiac event, a cardiac problem. Can we network the hospitals around you, where the patients go, and can you channelize them to in the right time, within the golden hour, so that you are prepared and you are able to improve the outcomes. So that's another thing which we are doing. We spoke about teleradiology, and of course the speaker spoke about the emergency response and how well we can see that we can leverage in a emergency, how quickly we can put together and we can be prepared to serve the patients. So how are we doing this? With the partnerships, it's GE company, but very clearly we know that we can't only as GE do this. So we are partnered with Apollo Telemedicine, we are partnered with Tricog. In terms of product solutions in the area of infant care, we realize that GE has solutions only for 1/2 of the needs of an infant care specialist or an NICU. So we are partnered with another best-in-class company like Natus. And we understand very clearly, in all these geographies, and basically even in healthcare, in any form of healthcare, you need a blood chemistry, a good lab, to support you. And we are also partnered with a company called Iris to bring that to you. So it's all about bringing in complementary scope, while our primary purpose is to take, the GE technology, in a form that is being, very efficiently, in a form that can efficiently translate a service for improving your clinical outcomes. And also not just GE technology, also companies that are best in class and can complement to make sure that the healthcare delivery done by you is the most efficient. So this is what we are doing here as Genworks, and we're glad that we're able to put this together, because not just selling equipment is what we believe is going to make things efficient, but bringing in needs, understanding your needs, serving your needs to the best possible extent. These are the first few things that we have done, and I'm sure the list is going to expand, and the more I interact with you, and this is one opportunity that I got to interact with many of you here over the last 2 days, that we realized that a lot more has to be done. And thank you for this opportunity, Dr. Jeet, and the organizing team. And it was great interacting with all the experts here. And we look forward to serving you, in the same way, in the spirit of wanting to, provide solutions to improve clinical outcomes. Thank you.